About omega-3. There are also plant-based omega-3s, of course. Alpha-linolenic acid, which is found in seeds, is in flaxseed. But it doesn't have the benefits that studies have shown, especially with EPA and DHA, which are only from marine sources. It's also found in the yolks of eggs from happy chickens that eat a varied diet. Well, but mainly it's of marine origin. Krill is a very interesting source of omega-3, and it also has phospholipids, which are fantastically absorbed. Suddenly, for more therapeutic doses, we need another type of omega, but it has several advantages. Very little heavy metal content, it is a tiny crustacean, it is what whales feed on. And above all, it has very good bioavailability. It is absorbed quite well. All right, so as arguments for veganism, sure, if you don't consume eggs, dairy, or any animal protein, but you're consuming omega-3s of this type, you're not getting the EPA and DHA, and that's serious for development, especially for children and during pregnancy. Yes, there is omega, EPA, and DHA in algae oil, which you can find these days, fortunately, and it will be a supplementation option for vegans, not for ovo-lacto-vegetarians, because they consume eggs, and in eggs we have these omegas, and they're also in cheese. So ovo-lacto-vegetarians wouldn't typically have those kinds of deficiencies. Well, during pregnancy, it has been confirmed again that omega-3 supplementation improves neurodevelopment in mothers. It supports learning functions and helps with the development of intelligence. Studies have been done on IQ in those mothers who supplement, and then those children show better results in DHA as well. Attention, especially DHA is the one that has been studied for brain health, eye health, and also for brain health. DHA is the most abundant in the brain. EPA is more cardiovascular related, more anti-inflammatory, and DHA contributes to the visual development of children according to the EFSA. In other words, this is a fact. And if we have it low, ideally we should supplement it. Improvement in learning rules and vocabulary when supplemented, therapeutic doses in children lead to decreases in hyperactivity and attention deficit disorders, and it increases neuronal growth in the frontal area, which is related to processes of abstraction and intelligence. At the level of preventing coronary disease, studies have mainly been done on patients who have had heart attacks and are supplemented with doses usually around 2G. These are higher doses of omega-3 from marine sources, from fish, and the evidence shows that it significantly reduces mortality, especially in patients who have already had heart attacks, for example. It also reduces cognitive decline. We have Alzheimer's, which is an epidemic, and also earlier onset dementias. It's a preventive factor. As I mentioned before, it decreases the incidence of death from any cause. Omega-3s are also linked to telomeres, meaning they are associated with longevity. It decreases brain aging and inflammation, especially the EPA component, which increases HDL, the healthy lipid, and lowers triglycerides. But in that case, you need to give higher doses of omegas. What are the doses of omega-3s, maximum doses of DHA and EPA? We're talking about 5 grams a day, which is a very high dose. Normally, you never give that much. If only EPA is given, the dose would be around 8 grams, the upper limit, and if it were DHA, it would be 1290. Usually, it's supplemented with 1,000 units. In some cases, much more, but it's very safe. Well, in the Lancet, this study recommended 1 gram a day of fish omega-3. This is a somewhat old study, but it still holds relevance for preventing myocardial issues. So, to get 1 gram of omega-3, EPA, and DHA through food, we would need to consume about 85 grams of tuna or a small fish like sardines, or salmon, or 652 grams of Atlantic cod. That would be to achieve those doses of 1 gram a day, which is what they recommend for those who reach this. Well, it's hardly possible unless you follow the Mediterranean diet to achieve that. In the Heart Association, they recommended 2 meals a week of fish and 1 gram a day of supplementation with fish omegas. There are laboratory studies where they check the omega-3 index, see how much is in the blood. They do this by measuring the red blood cells. And if the percentage is greater than 8%, there's a preventive factor. For diseases, especially cardiovascular ones, it shouldn't be less than 4. In patients with high triglycerides, doses of up to 3 to 4 grams are given. And to seek an anti-inflammatory effect, we would talk about 2 grams of omega-3. So the dose will change depending on what we're looking for in the patient. It is